Top story this half hour, CDC cutting more than $11 billion in post-COVID grants to health departments all over the country, including right here in Rhode Island.
Kristen Burnell joins us live from Providence this morning with what comes next.
Well, good morning, Kate and Patrick. The Rhode Island Department of Health says they were using that money for more than just COVID response. Now they say they're working with state leaders to figure out what comes next. Federal health officials announced that the reason for the cuts is due to the end of the pandemic. A spokesperson with the health department says they were planning on having the $30 million to fund work beyond COVID, including childhood vaccinations, future pandemic preparations, and employee salaries. But it's not clear how many people would be impacted. The department is now working to protect the funding with state leaders, including Rhode Island Attorney General Peter Nerona, who first broke the news on 12 News at 4 yesterday.
That they've abruptly canceled $30 million of monies used for childhood vaccination, to plan for a pandemic, how to respond to one. Look, the state's going to have to make the decision. Either we're going to continue doing that work at state expense or not do it at all. But if there's a fight to be had there, and I believe there is, it is my office that will do that fight, lead that fight, keep that money for the state. That's why, to me, it's so important that the state invest in my office and the governor stand with us.
And we're told that the funding cuts will not impact the construction of the new state health labs in Rhode Island. Reporting live in Providence this morning, Kristen Burnell, 12 News.